November brings Thanksgiving, and for some people, Thanksgiving brings football, and sometimes orthopedic injuries. This month, we'll focus on scanning the knee, finding quad tendon ruptures and effusions. I like to start in the suprapatellar region. The indicator points towards the head, the probe's in the sagittal orientation, and here's a normal view. You can see the striped appearance of the quadricep tendon and how it attaches to the top of the patella. Here you can see there is a disruption in the quadriceps tendon. Those stripes we saw on the last clip aren't very clear anymore, and there's some fluid in there. This is consistent with a quad tendon tear, right? We don't see that nice stripe look anymore. Here is what a knee effusion looks like on the suprapatellar view. There's black fluid under the quad tendon and above the femur. I've had a few times that this spot actually had an easier pocket to drain than the medial or lateral views. And now to round out the rest of the knee views, here's a look at the patellar tendon. There's a normal clip here. You can see the insertion of the lower part of the patella and follow it down into the tibia. Here is a lateral view of the knee. You're looking at the joint line between the femur and the fibula, and sometimes the tibia will sneak in, but you can see it looks a little bit like a divot. And finally, the view of the medial knee. This is the interface between the femur and the tibia. It's very similar to the lateral view. There's not fluid on this view, but this patient was training hard for the Burby Derby and has a little hypoechoic area that could be a strain of the medial collateral ligament. Here are a few views of knee effusion seen from the medial side. The smaller one is on the left, and there's a larger pocket on the right. You can see that anechoic fluid right around the more bright hyperechoic bones. That's it for this month. Scanning the knee is a great way to get started with joint ultrasound. I hope this video helps make it a little easier to take a look.